Good to be here. It's been a long journey to get to this point. I was born in Nigeria, came here in 1997 after high school. I know exactly when I came in. I came in January 21, 1997. And my father was in Saudi Arabia at the time. He's a pediatrician. My mom, he's a librarian who was in Nigeria. She was taking care of the house. So I came here by myself. Came in here, went to college at Virginia Commonwealth University in Richmond, Virginia. Graduated in 1999 with a 3.98 GPA, summa cum laude. Got into medical school at Howard University. That was not as easy as I expected. I had to go through pharmacy school for the first semester, and then I was able to meet a guy who actually told me that I should consider medical school because I was very good in anatomy, I was very good in biochemistry. So I applied to Howard University. I had a great interview. I've told this story many times with Dr. Ash, who was apparently the 2 weeks before I had the interview, his son passed away. And so when I went to interview with him, I had no idea this was happening. But he kept looking at me. And after a while, he said, you remind me of my son. And I said, oh, how is he doing? He goes, my son passed away 2 weeks ago. He asked me about my father, my role model. He just said, who's your role model? I said, my father. And he said, talk to me about your father. When I started talking, I knew this was going to happen. I always kind of tear up when my dad comes up. Yeah, I started talking about my father, and I started sobbing. And I was hoping that he was going to let me stop. But he kept telling me, keep going. And the more I spoke, the more I sobbed. And then, the man got up. He's a PhD in microbiology, by the way. Came to my side and just told me in the best voice ever that, hey, son, don't cry. We will take you at Howard University. That was the biggest transition of my entire life, because without that man who passed away in 2015, I wouldn't be here today. This was the last day of the interview for medical school. So literally, the last open spot was mine. So when I started at the Howard Medical School, I didn't have any money. I had saved about $10,000 from working in an autistic home of 4 kids. And those kids, basically I worked like from 10:30 to 7:30 in the morning. Saved $10,500. I was able to use that to pay my tuition. After the first semester, I had no money. And I knew I had no money because my dad couldn't afford the $25,000 tuition. So I went to the financial aid office, Dr. Dean Lloyd, he's also passed away now. I went to him and said, I really want to be a doctor, but I have no money. He said, well, what are your grades from last semester? I told him I had all honors. So he said, I have one merit scholarship left. He said, but you have to get all honors every semester, otherwise you lose it. So I said, I'll take my chances on that. And I was very happy. He gave me the full scholarship. And every semester, for the rest of my medical school years, I had to show my grades to Dean Lloyd, and then he would approve the next semester. Never approved more than one semester at a time. But I was able to get full scholarship for 7 semesters by getting all honors. And then, of course, I finished valedictorian of the class. The story I was going to tell today was when I was in my 4th year of medical school, you have to do what we call a rotation in a hospital where you want to train. So I was interested in orthopedic surgery. And orthopedic surgery is a very competitive residency specialty. And then, of course, Harvard orthopedic surgery is very, very competitive. So when I did my rotation at Harvard, it was 10 or 11 medical students that were rotating through orthopedics. So orthopedics is very diverse. So there is orthopedic spine, orthopedic sports medicine, joints, oncology. There is foot and ankle. So all of us were scattered throughout the entire specialty of orthopedics. They have only 10 spots. They get 11 to 12 medical students every month. So think about how many students rotated through Mass General Hospital and the Brigham Women's Hospital. So we sat in front of the chief, Dr. Rubash. Dr. Rubash is about 6'8", a tall orthopedic surgeon who specializes in joint replacement. So Dr. Rubash sat down in front of us. There were 12 of us there. And he told us a story. And he said, my son plays baseball. My son was hit in the head 2 weeks ago. And ever since he was hit in the head, he has been having headaches, severe headaches. And he said, so what do you guys think my son has? So I was sitting in the end of the table, and we had students from Northwestern University, students from Stanford, Harvard, Yale, Princeton, and then I'm from Howard University. He said, "What do you think my son has?" And there was silence. I think a lot of the students, including me, we were more scared to say the wrong thing than anything else. So after about 30 seconds of silence, I decided to say, I think your son has post-concussion migraine. Now, I wasn't sure if that was the answer, but he had headaches, he had a concussion. I just put two and two together and I said that word. I said that diagnosis. And then Dr. Rubash said, who said that? I was nervous. I raised my hand up and he said, stand up. Stood up. He said, come see me in the office after this conference. So I go to his office, again, 6'8", I'm like 6 foot. He goes, that was a bold answer and you were absolutely correct. He said, are you interested in doing orthopedic surgery at Harvard? I said, absolutely, that's my dream. He said, if you want to come here, we're going to rank you high. And it's up to you to decide if you want to come to Harvard orthopedic surgery. So, of course, I was just overjoyed and overwhelmed. And I ranked Harvard orthopedic surgery as number 1 on my list. And on the day we did the match, I opened my envelope and I saw matched at Harvard orthopedic surgery. So that's how my life changed. I moved from Washington, D.C. to Harvard, to Boston, Massachusetts. And, I told the story before how my counselor, the new counselor at the time at Virginia Commonwealth University, had emailed me and talked about having a retirement party for Dr. Seidenberg, who had retired. Response was, thank you so much for the invitation, but I would respectfully decline because of all the things that Dr. Seidenberg had done to dissuade me from being a doctor. So the new counselor said, I'm sorry for what happened, but based on the signature of your email, you absolutely made it, and you against all odds. So that was a very poignant statement for him to make. Never met the guy before, and then I continued my journey in my residency. I was going to be a joint surgeon. I loved orthopedic joints. One of my mentors was Dr. Burke. Dr. Burke was an amazing surgeon. He's the one that taught me the phrase, every day is always the same. What does that mean? It means if you don't change what you're doing in surgery, then you reduce your chances of having complications. So you want to do it the same way all the time so that your staff knows what you're doing. They're not guessing. And once you adopt that technique, your scrub tech gives you exactly what you need without any words exchanged. So I took that to heart. I was going to do orthopedic joints. And then when I got to my 4th year, I met Dr. Bono. Dr. Christopher Bono is an orthopedic spine surgeon who is amazing. He's a man of intellect. Everybody in my class decided to go to another specialty except spine surgery because spine surgery is difficult and boring, according to some surgeons. And I figured, if everybody is going away from spine surgery, there has to be a reason why spine surgery is the most profitable profession. So I decided in my 4th year that since everybody's going away from this spine surgery, this is exactly what I'm going to go into. So I developed interest in spine surgery, mentored by Dr. Bono and Dr. Wood. Decided to do my fellowship at Harvard. I did a Harvard Spine Fellowship. I was able to learn a lot of things. Even when I moved to Longview, Texas, my surgical reference cards were Dr. Bono's. I used Dr. Bono to build my practice. And then, like I said, to keep it short, I started my practice here in Longview, Texas, and I've been here for 15 years. I started doing SI fusion in 2013. When I started doing SI fusion, nobody wanted to do SI fusion because SI fusion was in the infancy at the time, especially the minimal invasive type. The open technique was known for infections, wound breakdown. So most people never did the open technique. So when I found interest in SI fusion and SI dysfunction, I realized that 30% of people that have back pain is because of SI dysfunction. It's very common in women with multiple children, women that have a BMI over 30. Very common in people that have had back surgeries because of we call it adjacent level disease. Common in people that have trauma to the pelvis, maybe from a motorcycle wreck or any kind of fall. A lot of chiropractors, they see SI dysfunction. When you go to see a chiropractor and they say your hips are out of alignment, that is your SI joints. That means your SI joint is out. So they adjust the SI joint quite a bit. So when I started doing the surgery, I was doing the lateral to medial technique. So the lateral to medial technique is the first generation SI fusion. And I have a model here that you can actually look at. Eventually, if you can't see it, it's okay. But the screws and the wedges are coming in from the outside into the inside of the sacrum. So you go from, we call it the lateral to medial technique. All right, so lateral to medial technique. The unique thing about what we're describing is called the PML. The PML is a medial to lateral technique. So we're going the opposite direction from the posterior side. Now, when you do this conventional technique, which is a lateral to medial, you have to do it on both sides in some cases, and you have to make two separate incisions to get access to the SI joint. So if I grab the bigger module here, you can see everybody has two SI joints. The lateral to medial technique is unique because that's how we started doing minimal invasive SI fusions. But again, you have two incisions on both sides, and then there's a blood vessel that travels on the outside, which we call the superior gluteal artery. That artery can be transected, a branch of it, when you're going from lateral to medial. And you can lose about 1 liter of blood if you hit that vessel really good. So this technique that we developed called the PML, the posterior medial to lateral, it's one incision right in the middle as opposed to two incisions. And you get access to both SI joints. As you see in this acrylic model, you can see the screws going into the SI joints on both sides, diverging away from the midline. So I always tell people, this surgery is about a centimeter incision compared to like a 2 centimeter or 3 centimeter incision on both sides. It's a very simple surgery. You use fluoroscopy. You can palpate all the anatomic landmarks. Once you put the two screws in on both sides, it locks the SI joint together. There is no weight-bearing restriction on this surgery compared to the conventional technique. And how did I come up with this? I had done over 1,200 lateral to medial SI fusion. I had done more SI fusion more than any surgeon in the state of Texas. I used a company called SI Bone, which they are the early believers of SI joint dysfunction, implantation for the pelvic dysfunction. And then a lot of companies, when I started, there was like 1 or 2 SI companies. Now they're like 75. That tells you that the market is amazing, is high, the demand is high. So we started doing this research about the PML, and I was able to partner with the SI Bone company and do the biomechanical testing. And it showed that this PML was actually a very solid construct. We were able to get FDA clearance in 2024. The process of FDA clearance is to get a 510K. The 510K has to be approved by the government to say that the technique is safe and effective compared to the existing techniques. And then they gave us a letter saying you can proceed with the 2 screws minimum on both sides. We went to New York, gave a presentation at the #1 hospital the orthopedic hospital in the world. It's called Hospital for Special Surgery. It's called the Frank Camisa Symposium. They invited all new innovations in spine surgery, and I was lucky and privileged to be able to give my talk on PML, which was received very well. So I've done over 1,000 PML surgeries. We have over 90% success rate. These patients have no weight-bearing restrictions. They don't even have to stop their blood thinners before surgery because the incision is so small. Now, if you want to stop the blood thinners, I have nothing against it. But if you don't want to because of your heart problems or history of blood clots, then you're totally welcome to proceed with the surgery without stopping it. We have testimonies of patients that are waiting to give testimonies on our podcast. And, when the time is right, we'll have patients call in and give testimonies on the PML technique. The journey has been very rocky, ups and downs. Like I said, failure makes you learn that you appreciate success when you fail. And that's what PML has been to me, and and just my journey in general.